Here, this person's mom died at breast cancer, age 49 years, and left 4 children, ages 7 to 15. You know, I see this so much. I had a lovely, sweet girl. She was 35 years old from Texas, breast cancer, gave her aggressive radiation, called me with lung cancer, couldn't breathe, called me a little too late. She died and left 5 kids. I remember years and years ago, there was a local lady, 5 kids. She was 30-some too. 5 kids at 30-some years old. Amazing. They had radiated her left breast so much that her skin was hard as this desk. I guess there's some humans that can live with themselves and do that. But I do believe in karma, whether you know it or not. That's sick to me. Sickening. Sickening. That's why this site is so important. And you guys are so important. I just got talking to Sandra, and she wants to become a healer, and she's kicking butt. Good, become a healer. We need to get out of this consciousness of applying suffering agents to our fellow man. I feel for you, my friend. The sad stuff. Nobody ever should die of cancer. It's ridiculous. I was diagnosed with triple negative breast cancer in October 2012. Who is this? This is Regina. Hi, sweetheart. Oh, you were diagnosed with triple negative breast cancer? I never heard of triple negative breast cancer. Oh my God, is this something new? I was a vegetarian for 5 years prior to my diagnosis. Now, I think that it's important that be brought up, the fact that just because you're a vegetarian, that doesn't save you from anything. Not at all. It might save your kidneys better and things better than being on proteins, for sure. And you will live longer, your life will be better, but, you know, it is in the raw. The truth is in the raw, not in the vegetarianism. But it's a process that we go through. We get rid of meat, then we get rid of milk, or we get rid of this, we get rid of that, and we go down the line that way. Then we get into vegan or lacto, vegetarian, and you finally make it to the raw foodist. And then in the raw foodist, you can go up into the fruitarian levels if you want to visit that. And I suggest that for detox at least. And to have a high fruit and berry melon diet, at least have a high amount of that in your life. Now I am 70% raw vegan and eat fruit throughout the day. Smart woman. My question is, I am contemplating surgery. I feel that my tumor has grown. I am afraid that my strict eating and supplements is not working. According to the surgeon, she said that my cancer has spread and has doubled in size. I don't have a doc that oversees me. How can I check if I am healing? I really feel that those of you that are dealing with some of these cancers from the medical doctors should have one of us practitioners, if you will, help you. Counselors, help you, counsel you through this. But I'll say this, you want to be on the herbs. You want to get on them now. Because I don't do just diet when I'm looking at tumors and stuff. No way. So I highly recommend you get on these and you get on them now. 2 kidneys, 2 lymphatics, 1 capsule, 1 liquid, at the very least. Get on our first kit and then head down that 14-week protocol, because I designed that for these type of issues. It's enough to say that a little help would help you, because you don't want to sit there and just do half of what you need to do and then have it grow and grow, and then you have to go through this anyway. No, let's go after this the proper way, sweetheart. You want to hit those kidneys and adrenal glands real hard, because they have to open the doorway for these axillary lymph nodes to open up. It's the only way. It goes right to the kidney, but it's got to open up. And these lymph nodes are right there. But they have to open up. The kidneys have to filter. So you have to go after kidney filtration. That is essential, and you've just got to do that. You can pull that tumor out with a black salve. I would need the size of that tumor. If it's real big, I'd go ahead and have it removed. If it's not, I myself recommend black salve, because it'll pull that out and it'll pull anything else with it. You don't have to worry about clear margins. But you must realize, no matter which you up for, surgery or black salve or do this the right way, you still have to do this the right way. Because if not, you'll grow a tumor back on the chest wall. Yeah, if you do a mastectomy, I've had them in here post-mastectomies with tumors grow back on the chest wall. You have to fix this kidney filtration problem no matter what you do, Regina, honey. You got to do that. So that you got to do that. So no matter what you do, but I'd like to see you get with this the right way because you have to do it anyway. Either way your choice is, I'm behind you 100%, sweetheart. But you got to fix your kidney filtration problem no matter what you do because the rest of your body's involved, not just the breast. So you want to fix this the right way. By the way, I would start right now on a 40-day grape fast, period, end of story. Right now, Regina, 40 days. Grapes, all you can eat. Much as you want, often as you want, but nothing but the darker grapes, okay? Start today, or when you get this video. When you get this, you start. I don't have a phone number to call you, or I'd call you. Get yourself going on this grape fast. You can't half-ass it and then expect this to go down. It's a big deal anyway. Because by the time you wake up to tumors and things like this, you're in big trouble. Your lymph system has been down for years, if not from birth. So this is a big deal. This is a fluid-based system that's miles long. This is a big deal, and you want to fix this one, sweetheart. Don't mess around with this, okay? All right. About 5 years ago, a specialist and other doctors over a 3-year period gave me 11 CAT scans. That's unforgivable. 11 CAT scans, and I'm sure they're not in the new digital types where it's half the radiation. 11 CAT scans is not even good there. I don't know, what do we got? Almost 200 rads maybe per scan. That right there is cancer causing, and she had 11. One is considered cancer causing. She's had 11 of them. 3 of them are eyes, to which 3 swollen lymph nodes by my right lung. Well, again, see, the thing is that people wouldn't have to go through this if they just realized that it's the lymph system that is the problem, and that system is what our focus is here. And getting into that system is vital because lymph nodes and all this, of course, all tie into the lymphatic system. They're the septic tanks of the body. You get the lymph nodes backed up, of course, and then the sewage backs up to the cells. So it really starts backing up from where? The kidneys controlled by the adrenals, and it just backs up through the whole body here. By the way, the lymph nodes were okay. Needless to say, I got breast cancer. I refuse to go to these doctors anymore. Probably a good idea, sweetheart. I have a lump the size of an orange in my right breast and cancer through my mammary glands. I am a vegan now, vegetarian for 20 years, and have been drinking carrot and veggie juice for a year now. And this is where I made my mistake too. I had a swelling in my body and I went to carrot juice, which is what we used to do back in the old days. But see, it's like we're talking about in class. You guys are going to take this, and some of you are going way on out there, and I just love that. And you see the difference. This girl, for a year now, she's been doing carrot and veggie. Had she been doing grape juice for a year, she wouldn't be writing this letter. So that's the problem with veggie juice. And people have to get over they're using the veggie juice to try to remove tumors. Wrong type of food to get into the body and have an astringent effect. Also, you must understand that you got to get into your kidneys and the adrenals on top. Get those filtering, and then that tumor will have a pathway out. But the cancer keeps growing. That's because you're not moving your lymph system, sweetheart, and you're using the veggie juice, which doesn't have the power for deeper work, which is what you need. Plus, you have to consider the role of the kidneys and the adrenals. And that, if you can't get the adrenals to trip up the kidneys, you can't get this tumor out. So this is essential work. When you're working on the lymph system, the kidneys and adrenal glands are a vital part of this issue. So how do I stop it from growing? It's not growing, it's backing up. This is sewage, simple sewage backing up. And this is acids, so you're damaging. It's all that inflammation from all that acidosis, and it's just damaging more cells and more cells and more cells and more cells. And matter of fact, remember, this is systemic, so your body's backing up all through it, not just in the breast there, but it does show that the right breast, of course, the right kidney is probably more at issue than the left. How do I break up the large, hard lump? Now here's another thing. You can use castor oil packs and stuff like that on these lumps. Hot and cold compresses would be okay, or hot and cold applications, but really getting that kidney and adrenal opened up on that side is super key. Also, there's a video we did, the neural lymphatic points. Work on those neural lymphatic points down your spine and start trying to get that lymph system to halfway drain through kidneys that are probably not allowing it to take place. But work on all that together, so you're moving this body as much as you can and moving that lymph as much as you can, because that's the secret. You can't filter, you can't remove tumors. If it gets too much, sweetheart, I'd recommend pulling it with a black salve or having a lumpectomy if it gets too big. You don't want it to get any bigger, and especially with the size of an orange. I would also highly recommend you shift your thinking from vegetable juice to fruit juice, and I would really hit the grapes and lemons. You go on a 40-day grape and lemon fast, sweetheart, and I'd probably start it as soon as you get this if you haven't started it already. That's the key. Real important. You're using the wrong food. And then you want to get on the lymphatic herbs, you want to get on the herbs for the kidneys, you want to pop those adrenals up, get those adrenals to turn on the kidneys and start filtering. That's key. And I'll also clean up my GI tract. That's all tied too. So just what we're talking about in these videos, get in your body and go after those things, and you'll be successful at getting this. Your lymph system's backed up, but you've also burnt yourself with 11 CAT scans. That's a lot of CAT scans. So you probably have a lot of cells in your body that's kind of atypical, kind of hanging there. And so you'd be the one they would use the word metastasize, which is ridiculous. You're systemically involved, and then they came in and started burning you. So you just, Liz, take off after it, sweetheart, or you call in and have us help you, but you get your butt moving. Wrong food to detox with, and that's been my point about vegetable matter. She used vegetables. I did too. Jensen did too. Jensen woke up with a high PSA, well, higher than I've ever seen before, and he went on a 3-month carrot juice fast, and that is filmed. I have that film. He filmed it and wrote a lot about that. He got down real small, but couldn't get rid of the cancer. Wrong juice, but he got trapped where I got trapped in. Carrot juice was the juice to fast with. This is a starchy juice that really has no astringent power, and I just, it's always been considered a liver detoxifier. Well, beets are far better. So you have all these old thinking things, and in clinical work, we've learned way beyond these ideas that people have used in the past. In clinical work, we're way beyond veggie juice, because we know that doesn't work. Been there, done that. So that's why we're pushing the fruits on this side, because they do work. Been there, done that. I have a very large tumor in my breast by the armpit. I do not want to be cut up or have chemo or any other garbage. Okay, so let's take your case, Harriet, and this will represent most breast tumors, but really almost all cancers. Depending how big this is and how hard it is. If it's real hard, I would suggest that you use castor oil packs on there. It acts like Laetrile to help loosen this up. At the same time, the blockage is in your kidney here. Which breast? Did you tell me? You didn't say which one. Doesn't matter though. Let's say it's the right one. Your blockage is in this kidney, and that backs up your lymph nodes right here, and then backs it up in the breast here. Now, the kidney is controlled by the adrenal gland on top of it, and the neurotransmitters is most responsible for the functioning of the kidneys. So if you're younger, you could have a combination of kidney weakness and adrenal weakness. As I've been saying through these videos, most of the younger people have very serious kidney and adrenal weaknesses. Therefore, you're seeing a lot of neurological problems coming up in these cases, and also the suppression of kidney filtration of the lymph. So this is what I would do if I was you in moving this tumor out of here. And if you can't get it out, if it's real big, I probably not dare show you pictures of large tumors. I've got tumors we pulled out of people, ended up being this big. That lady ended up at Johns Hopkins. I had to have it done anyway. She got to save her breast because we pulled all this lymph up into this big, gigantic tumor. But that really freaked us out. I would love to be able to show and display pictures here of tumors. We have just tons of tumors here because people come here after the medical profession has released them to die, or after they've just really ravished them. I could show you one picture here that I was just showing one of my clients of a lady that didn't do anything. And remember, these wastes from the lymph system are acid. She didn't do anything, and it literally ate her breast right off. And so you've got to do something. And the most important thing you can do is fix the cause of the problem. That'll reflex and drain the breast if you can do it fast enough. So the biggest thing is I would do 2 kidney formulas. Now, I'll just use my kidney formulas as an example. I don't care whose you use, not overly trying to push mine, by any stretch. But you want 2 good kidney formulas. There's a lot of great herbs that's for the kidneys out there. That's why I have 2 different formulas, because there's so many herbs you can't get them all in one. So I would do 2 kidney formulas. I would do a formula I call mine Lymph Node 2. Now I have like 6 lymphatic formulas, and the reason there's so many great lymphatic formulas or lymphatic herbs, and how interesting it is that the lymphatic herbs in nature are the cancer herbs. So I would at least do 2 lymphatic formulas. I would probably start with a lymphatic 1 capsule, and I would do Lymph Node 2, which is basically a black salve kind of, in liquid form. I would definitely make sure I'm working on my adrenal glands. I'd either do the endocrine gland formula. If your blood pressure is real low, do the adrenal gland formula, or get an adrenal glandular and get the blood pressure up, get those adrenal neurotransmitters up so it'll turn on the nervous system in the kidneys. I'd probably do Parasite M just to keep the fungus and the bacteria down to a low roar. You really want to hit the lymph, and you really want to hit that. Being that you made comment that it's a large tumor, I don't know how raw you've been, but I would go up to a grape fast. Either grapes and apples, grapes and lemons, or just grapes. The darker the better. And I would stay on that for 10, 20, 30, 40 days at least if you can. After you pass the 3rd day, you're good to go anyway. So the longer you go, the better off you'll be, honey. And I would hit that real hard. If you come down off of that, I would do fruit all day long and maybe a salad at night. Depends how big this is and how fast you see that going down using those techniques. Because your goal is to restore the health of tissue. And the health of tissue that deals with tumors is primarily the kidneys and adrenal glands. And that would be very important that you get with that. I'd really hit the grape fast. Or you can do the 10-day lemon or 20-day lemons fast. I have a lady now, I think she's on her 45th or 6th day of lemon juice. These kind of things are going to take if that's a large tumor. It just depends how fast we can get that kidney filtering. To check your kidney filtration is to get you a wide mouth jar and pee in it. And take a look at that urine in that jar. If that urine is clear, doesn't matter what color, it could be yellow, it could be amber. If it's clear, you have lost kidney filtration. Well, I can tell you already have. Now, you could be picking up some left or right, whichever side doesn't have the tumor on. You could be picking up some filtration from that. But ultimately, you want to see snow in your urine. You want to see a lot of sediment. It looks like dandruff. That's the lymph system. Dandruff is the lymph system. That you want to see you want to see chemistry in that urine. Then you're going to see this going down because these lymph nodes have got to drain first before this is going to drain. Do not, though, be cautioned with biopsies because what we see is what I'm sure they see is that once you do, it explodes and it rapidly creates serious problems. I've had tens of thousands of breast cancer cases in my life. Same story, except for those that come before they do that. Same story. And it's like, man, why did they even do that? Leave it alone, because you got to get rid of that no matter what. They need to learn black salve herbology, how you pull that out, or simply how you fix why you've got it. Because remember, in the earlier stages, now I talked to another lady in here with breast cancer, and she had a friend who had a pea-sized tumor who's now dead. I told you of another beautiful lady. She was in 20-some. Her husband wanted to do chemo. They were scared and all that. I said, please, it's the size of a pea. Pull it out. Get rid of it naturally. Those are easy things to do. She is now dead. So, we're looking at a modality that is the top killer of humans on the planet. And when you look at that with respect, I think we need to readjust the way we see things. Because we just can't keep going down this archaic road of black magic and stuff like that deals with pseudoscience and things like that's only hurting people. That's insane. So you've got to get tumors out no matter what, whether benign or they have cancer cells in them. Who cares? Sometimes out of fear, we do things that accelerate our death when we didn't have to. That's why I say lose the fear. Understand the lymph system, understand what lumps and humps and dumps are, and get rid of them. All this. And the kidneys, what Dwayne's fighting here, the kidneys is that pathway. I don't care what the medicals say. Kidneys and skin, sweat, pray for fevers. And here's another thing for you ladies out there, and I would say I'd put this warning out worldwide. Do not fall into the biopsy scenario, and do not have them put the little, now they're blatantly putting a little piece of metal in where they do the biopsy. So a lot of women now have a foreign object in their breast, and if the body was kind of protecting the cells with a tumorous type of coating, they've broken that. So I think having biopsies and putting metal objects in women is an insult to the woman. I think that if you see a tumor in a woman, you can already assume that you might have some cells that have been morphodized or broken down, called cancer cells. You could assume that, okay? Because whether it's benign or cancerous, what are you going to do about it? You're gonna reverse why you're getting it. That's number one, because if you have a lumpectomy, okay, have a lumpectomy, benign or cancerous. But once you go in and do a biopsy and put metal in there, I'm having a harder time getting this out of women because of that. So you realize that. Don't have them do anything to you. Make your decision. I'm going to have medically removed, or am I going to get this the right way? And if you have it medically removed, remember you have to come back and do it the right way anyway, or you'll form another tumor. Remember, this is about causative issues, not symptoms. Symptoms are obvious, obviously, but what's causing them? That's the point you want to address, is always the cause of something. Then you're done. You don't have to worry about it. The rest of your life, you're done. You don't have to worry about it because you fixed the problem. And that sounds so much better than going and have a piece of the breast taken now, and then maybe a mastectomy later because you're going to get another tumor. And it's just on, and then, chemo, and then, and then we have the dream teams. I mean, this is all just insanity when it's so simple to realize how you're forming it and then what you have to do to reverse it. The problem, as we get younger and we get down the track of the time track here, we're getting much worse. Only the insane out there believe that radiation doesn't cause cancer. Only the stupid, or I don't want to tell you the truth people, believe that radiation doesn't cause cancer, because we all know, including the government, that it does. It was the government that tried to tell the people, this is one positive thing, tell the people, the women, that these mammograms causes cancer, and people wouldn't buy it. They do. I don't know how to say it any more than that. So you must set aside the radiation, and if you have your lump cut out or your breast removed, okay, why would you need chemo or radiation anyway? You don't need them anyway. They cause cancer. Why take rid of something and then give it back to you? My aunt had breast cancer 7 years ago. She had radiation. Of course, that didn't do anything. Just damaged a lot more cells. Now it's back all over her lungs. But I tell you something, guys. Let me just read this again, because this is classic. This is commonplace. This is pretty much the route that it always goes, or pretty close to always, and yet they still do it. I mean, that freaks me out. When you have that level of unconsciousness, it's one thing to have unconsciousness for a short period of time, but you have to be blind not to see this. My aunt had breast cancer 7 years ago. She had radiation. Of course, that didn't do anything. Now it's back all over her lungs. Common stuff. But she lasts 7 years. Most of the time it's within 2 or 3 now the ladies have full-blown lung cancer. Because they burnt right through. Because the lymph system that was backed up into the breast were also backed up where? In the lungs. Why? Because this is a systemic fluid. This is a systemic problem, not a breast problem. Breast cancer is not a breast problem. It's a lymphatic problem. You just notice it in the breast. But if you look through the body, you'll find your lymph system backed up all through you when you have breast cancer. It's not just in the breast. This concept that cancer is some type of conscious entity that moves and is going to attack you in all these places, they would love you to think that way. That'd keep you in high ignorance. And that way, oh my God, I have no remedy. This is a mean devil chasing me down the road. Not at all. This is a major fluid in the human body, as you've seen reading from the first. It's how you drain your waste products from your cells. It's no other waste products except a little parasitic problem, waste products from bacteria and stuff. All goes in the same system. According to the doctor, she doesn't have much time. According to the doctors that burned her and fried her lungs for you, or her, I think we did it pretty good. We fried him and she hasn't got much time. I mean, Jesus criminy. Still, they are trying to convince her to do chemo. You know what, amazing to me that you people don't even hear themselves. You know, doctors don't even hear themselves. You don't have much time, but, you know, still that chemo, you should do that chemo. We need the money. I need my new Lexus, my new Mercedes, do the chemo. I mean, the only reason you would think that is that because there's no humanitarian reason that you would recommend chemo after you fried her lungs with radiation. Remember, you shoot radiation, it goes right on through your tissues and burns all the way through. All of you know that. Those that have had it, some of the men that have had it on their prostate burn their pelvic area. And of course, where do you see the cancer come back? Right where the radiation destroyed those cells, because that's what cancer is a damaged cell, and radiation damages cells. Oxymoron. Woohoo. Cuckoo. That's all I can think. I'm trying to get her not to go to chemo, but go on fruits, berries, and melons. I also wanted to start her on the tinctures. Could you please advise which ones would be good? Adele, go to that 14-week protocol, or have Gin B. If you want me to write it, I'll write it. It's the quickest way for me to do, because I can do them at night at home, is these 14-week protocols. Getting in to see me is a little hard because I'm several months backed up. But I do write protocols at night. You just give me all this information. There's only one pathway. Get her on the fruits, the berries, and the melon now, and get her on this detox program. I use 2 kidney formulas, 2 lymphatic formulas. I'm into her lungs. I'm going to use the lung formula, the 3-lung tea, to help expectorate and pull this out. All this congestion. But you've got to get her kidneys and adrenals filtering. You got to go back and fix the breast cancer problem. That's the whole thing of this. So she's got to go back and fix why she had the breast cancer, because the same reason she got the lung cancer, with one exception, is they helped her get the lung cancer. Matter of fact, they're the ones that really set her up for it to go that far. You know, not good. So medical doctors have a big hand in her lung cancer and why she has it. They just won't admit it. So have Adele, have your aunt watch this video or whatever. I'm going to hopefully get it up today. It's not going to be a real long one. And maybe we can get her saved on there. But she wants to go immediately 100% raw. I don't care anything else. 100% raw. And I'd only do 1 salad a day here for a couple of weeks and get her totally on fruits, berries, and melon. Let's get her cleaned up here, get her kidneys filtering, and everything moving. Because again, going back to it's accumulation of waste products. But with your aunt, It's also the burn of the radiation. I mean, they know that. This is classical. I can't tell you how many breast cancer cases we've had in here that had mastectomies or whatever associated with them, had the chemo, the radiation, particularly the radiation, and now they have lung cancer. It's almost a given. It's every lung cancer that doesn't do it our way. I'm just waiting for them to come in with full-blown lung cancer. Oh, yeah. I can tell you stories that just sit here and make you cry. Of mothers with multiple kids where they do this shit too, and they know it's going to hurt them, and know it's going to kill them, and they still do it. Yeah, it shakes me off. I need a drink of water, of course. The lymph nodes is the only place your cells can go to be broken down. They're not going to go to the blood, so where would they go? What they don't understand is, how do you clean the lymph nodes? What's the problem here? So yeah, your lymph nodes are always involved. Your lymph nodes are always involved, always, because they're always in you and they're your septic tanks. So you're always going to have bacteria and immune cells in those lymph nodes to help us break down the corrosive cytochemistry, thank you, and any cells that need to be broken down. You know, you've got your Navy SEALs in there. Lymph nodes taken out, so what do I do? I would love advice regarding 2005. I had a complete hysterectomy for ovarian cancer. I didn't have chemo and radiation. One smart cookie, because it was a non-aggressive cancer. It doesn't matter if it's an aggressive cancer or non-aggressive cancer. It's not correct to give chemo and radiation at any level of cancer. They also removed about 8 of my lymph nodes to make sure the cancer didn't spread. Let me see. Make sure the lymph nodes so the cancer doesn't spread. Well, the lymph system is a detoxifying system to the outside world. How does cancer spread through the lymph system? It goes to the lymph nodes, but that's the breaking down factory. That's the septic tank. That doesn't make cancer spreading to the lymph nodes. That's where the lymph system's taking cells. All right, how can a cell travel in the lymph system toward the kidneys, go through the lymph nodes, and then somehow end up somewhere else in other tissue? I mean, these guys are smoking something big time in the back room. Some of this crap they come up with is idiotic. And you want your cancer cells, if the body doesn't terminate them on site, you want them taken to the lymph nodes. That's where all the immune work is, and a bacteria is. That's where you want that. That's the role of lymph nodes. Medical doctors learn the role of the lymph system and the lymph nodes, man. Quit hurting people. They remove the lymph nodes where you get lymphedema in the pelvic area or something. Honey, that's tough, because once they remove a lymph node, if there's still tissue on the other side that needs to use that pathway, that's real problematic. Now, can the body rebuild lymph nodes? I don't know. I have done enough research to see that. But it definitely rebuilds new nerve pathways, and so new vascular pathways, and can it build new lymphatic pathways? Everything's possible. Everything's a bunch of cells and 2 major fluids, right? Anyway, this black sap, actually just bloodroot, maybe some poke, but some bloodroot. That's all black sap is. Some lady, this was on the news where, and this is what, the FDA was so up in arms that this lady put this black salve on her nose and it took off her nose. Well, it didn't take off her nose, but it put a big hole there, I'm sure. Now, I said this on another video. Had a surgeon remove that cancer on her nose, she probably wouldn't have had her nose and half her face is gone. So what this lady did not understand is, yes, the black salve is going to pull that cancer out of there, but it'll heal up in time. But you have a surgeon take out a tumor, you're going to lose a lot of tissue. If you don't believe me, I've got a lot of pictures here to show you what surgeons have done to people. Not a pretty picture. When they're trying to get a clear margin, anything's up for grabs. So I'm going to tell you, what the FDA needs to get with this. These are natural remedies. The black salve is generations old. Generations old. But nothing wrong with it. I'll tell you this, though. I don't make it. You can get it. You can order it. They have different names for it. The Indians used it quite a bit. Native Americans had a lot of these type of salves. So great stuff here. There was a book written on the black salve. I can't remember the author of it, but you could probably Google it. But let's say you had a breast tumor and you were going to pull it out with black salve. The problem is that now that is a port because you didn't fix the cause. And this is going back to allopathic thinking. Allopathic thinking is, okay, so you have a lumpectomy. Well, a black salve is like a lumpectomy, except it pulls cancer cells. It can pull from all around that area. It can pull from your shoulder. It doesn't hurt you, and it'll pull that out. But that becomes a port, and it will drain, and it will leak. And it'll do that until your kidneys start filtering, or all these wastes are cleaned out of here. So it can be quite a while, it can stay open. Other people, it'll heal right up. So it can be either one. It doesn't matter where on the body it is. People pulled warts and moles off with black salve for years. Skin, basal cell, easy to correct with black salve. Easier to take care of with black salve than it is with surgery. Because if you notice, most surgeons that take off basal cells, it comes back as squamous. When you have a breast tumor, and it can't dissolve, and it's not real big, and you can't dissolve, I say no bigger than this, and you can't dissolve it, you might want to pull it instead of a lumpectomy, because always it seems that a lumpectomy, they're going to take lymph nodes. Breast cancer runs heavily in my family, and I'm worried about taking your formulas. Do not worry about that. Worry about, I wouldn't worry about that, sweetheart. I'd be worrying about the fact that it runs in your family, which means what? When you have a breast tumor, or you have fibrocystic breasts, why? What's going on here? Well, my sister had it, my mother had it, and everybody's having it in my family. But what are they having? Cancer is not genetic. Cancer as damaged cells are not genetically passed. Cancer, the disease word, diseases aren't genetically passed. They're illusionary concepts of allopathy. What is passed is the consciousness or the awareness of each and every cell. Talk about creation and the way the all steps down into individualized pieces like you and me and the horses and the cows. You look at that in the terms of cells and how each generation sets up a more limited expression, a more, I don't know how to put this, because each generation of cells gets its thinking from the last. So when you look at man's lifestyles and look at what man's eating, he's eating way off of his nature. He's a frugivore, a islander, living in northern climates, eating high-protein diets. You know, there was a guy on, Drew was just asking me about a guy that called in on dialysis. They want to put him on dialysis, and of course he probably has, high creatinine, and so they want to put him on high-protein diet. Well, that'll not only get him on dialysis, but it'll keep him on it too. So it's enough to say that when you're talking about family history of cancer, you're talking a family history of lymphatic problems. And when you talk about a family, because all cancers are lymphomas, the question is, leukemias, are they cancers? I mean, when you have elevated white blood cells and low platelets, that isn't a damaged cell. But when you're talking about, when we use the C word, when we use the cancer word, or they do, it means now the acids that were external to the cell is now building up in the cell, damaging or mutating the functionability of that cell, whether it's the chromosomes, the DNA, who cares what part of the cell, what organs of the cell are damaged, because it's the same thing internally as it is externally, except that for a while cells are able to poop external to themselves. They're able to eliminate through the cell wall wastes that are produced inside the cell. When the lymph is so saturated around cells that you're not moving that well because your kidneys stop filtering, what you have is an accumulation, which you can simply use the word constipation. This is why I coined the term interstitial, meaning around the cells, lymphatic meaning the lymph fluids, constipation meaning that fluid isn't moving anywhere fast. So as acids build, dehydration sets in because you're burning your electrolytes to try to bring this into a pH balance, into a base balance. So you're going to burn your electrolytes in that process. If there are more acids than there are electrolytes, guess who wins? This is why you see your urine initially turn alkaline, because you're basically scuffing off your electrolytes until this huge process of hydration takes place. And it is a process. And some of you guys out there are extremely dehydrated. Look at your skins are dry and dehydrated. That's interstitial lymphatic constipation. And this is why when you're diagnosed or you see it in your family with any type of cancer, it doesn't matter if it's breast, it can be hepatic, liver, pancreatic, it doesn't matter. It simply means that, one, you're not moving your lymph system and acids are breaking you down or your body down. And that, or your cells down, however you wish to take that down in there. You've got to get it away from the you, because the you is not the body. Sometimes you get caught up in that. I do sometimes. That's enough to say that it is important that you understand why. You don't pull the fear thing like Angela Jolie, who says, take them both. My family's there. That's stupid. It shows you the fear. It shows you the good job the AMA has done to infiltrate this world with fear and to be able to make the money they do in the processes they do. It's unfathomable. And that's what you're up against, a society that is money driven, that truth isn't something that they're interested in, because it doesn't cost a lot of money. So it's insane there. But Brianna, the point here, and I'm going way off on here though, and this is to everybody here, don't freak out with the word cancer. Be aware, be knowledgeable to the truth of what we know about how the body works in chemistry. Not the insanity of conditioned thinking, which is lost in high proteins and love acids and stuff like that. That's insane stuff. Insane stuff. So realize that you're a victim of a family that has lost their kidney and adrenal glands and the ability to filter, and that this is the problem. Now, the other problem we face in genetics is weaknesses. That the weaknesses of these areas after the stagnation of the lymph system, the weaknesses that occur from acids building up, these weaknesses are past. In weaknesses, the lymph system is somewhat compromised. And when that happens, that area accelerates into more problems over other tissue. This is why it's so important for all you young people to really grab a hold of this and think of body regeneration, total body regeneration for your offspring. You know, it depends where your head is at and where your consciousness is at and how you perceive where you're going to be and what you want for the future in your journey. This one lady talking about fibrocystic breasts, and this is a common problem among women. What do you think? What do you think causes fibrocystic problems? Could I say it was the same thing that causes fibromyalgia? Could I say that it's the same thing that causes lupus? Could I say it's the same thing that causes all arthritises? Absolutely. So go back. Remember that the body, including the breast tissue, is nothing but a bunch of cells and two fluids. And there's how many sides to chemistry? Two. Now, how simple is this? The human body is comprised of roughly 100 trillion cells that make up all the different tissues, organs and glands, whatever. You're only two fluids that take care of the health of them, just like taking care of your little children. At a certain point when they're infants, you've got to feed them and clean them until they can do it on their own. Your cells can't do it on their own. They always have to be taken care of. And that's the role of the two fluids. It's that simple. Fibrocystic breast, though, you got to go by the way of the kidneys. Remember how your lymph system works. Your cells eliminate waste. These wastes are picked up by the lymph fluids that flow around the cells. Remember, these interstitial fluids, or these fluids that flow around all your cells, are 75% lymph and only 25% blood, meaning that the body reveres the sewage system as much as or a lot more in a way than it does the blood. So it's a very intricate system. And a lot of people are always talking about their blood vessels, but they're never talking about their lymph vessels. Your body's full of lymph vessels, and these are your sewer pipes that carry these wastes to the lymph nodes. And remember, your lymph nodes are exactly the same thing as your septic tanks at your house. They're full of bacteria, and their job is to bring that roughly 3 pH acid chemistry from waste closer to 6. You don't want to hit the kidneys with too much of an acid waste, or you're going to hurt them. That's why, 3 pH chemistry, which is around most soda pops, very damaging to tissue. So when you look at the breast, you've got nothing but a bunch of cells, and you have all your septic tanks under your arm that drain your arm, that drain your breast, your part of your back, all drains into this huge bed of axillary lymph nodes, and then right off to your right kidney, and the same thing on the left side. That kidney is the key. If you have a tumor in your breast, if you have cysts in your breast, lumps in your breast, fibrocystic breast, this kidney ain't filtering. And it'll back up these lymph nodes first, and then that'll back up this. Everything backs up backwards. Takes time, but it'll really break you down. The same thing's true with fibroids in the uterus, ovarian cysts. Same thing, but for us men, it's the same thing with prostatitis and prostate. Same thing. Always the same thing. Now, I don't want you to tell too many people how simple this is. Kind of scary, isn't it? So, easy to remedy these fibrocystic breasts. Well, here's a government that says mammograms does cause cancer. I'll hand that to our government. Our government is on the ball and saying that mammograms do cause cancer, because that's a fact. All right, because radiation causes cancer. That's a fact. Can't get around it. And the way they do mammograms all invokes inflammation and damaging of cells. Well, why do we push to have them then? I'll tell you, society, when that came out a couple of years ago, and the panel came out and said, don't do mammograms, do them less, the world rallied and said, no, we got to have them, there's got a way. That was medical thinking. We're pushing for a scan or a diagnostic tool that causes cancer. No diagnostic tool should ever hurt you. No. None of them. And yet all of them have dyes hooked to them, radiation hooked to them. Look at CAT scans. My God, almost 300 rads. Yeah. Oh my friggin' God. And yet you have the simple iridology. And if you didn't have anything, just detox your body and clean it out.
Yeah. Remember the one that was in the other day?
Oh my God.
Had a mammogram squish her so much, which actually caused the tumor in the first place. So ladies, be careful with mammograms. You might want to go towards thermogram.
What we have found is the least medical intervention, the better, and the more chances you're likely to get well in the proper way of getting well. Through detoxification. If you don't have anything done to you, any biopsies or anything, you are at the top of your ability to get well. If you start having medical intervention, you start losing those chances, because medical intervention has nothing to do with getting well. It has everything to do with insulting tissue more, suppression, removal, and when you're going in and you're removing a tumor, okay, all right, that's okay. But what have you just done? You've went in and traumatized more tissue. He has to, or she has to, as a surgeon, to remove. They still have to damage billions of cells. What system has to go in and clean up the work from the surgeon or the work from the dentist? The lymph system. And if your lymph system isn't moving, you can't repair the surgical damage. So there's a lot to this. And those that go through this, their chances of living keep going down, 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 down.
And your chances.
Exactly. Your best chance of survival in this world is health. The focus of health, and drop these ridiculous concept of diseases in a wastebasket and understand really what's going on in your body. I was wondering if you recommended people with breast cancer and related illness to stop using antiperspirants because it stops the armpits from being able to release toxins. Oh, thanks, Mark. Well, you know, sometimes I can't remember all the little things like that. Of course, that's a given. All of them are given. You don't put any chemicals under your arm. You don't put any chemicals near lymph nodes. If you stink, you're just getting rid of proteins, dead tissue that's still in your body. So if you stink, you need to detox. And once you detox, then you should smell like the food you're eating. Oh, I had grapes this morning. Oh, that's orange juice. You know, I mean, funny, but it does kind of get that way. Your body fluids begin to, I'll just use the word smell, like what you're eating. Lymph is a little deeper, actually, than what a bra would probably cut off, but you just don't want tight, restrictive bras either. Cancer is real easy to understand. We have a concerted effort to hide the truth. It's a big, huge moneymaker. Look at all these people that are wearing the little yellow and pink ribbons, and everybody's donating and marathon runs and all this crap. You're just putting money in the same old pockets that does not want you to be well. There's been a cure for cancer since the beginning of time, because cancer isn't a disease. When you understand what cancer is, doesn't matter if it's prostate, breast cancer, ovarian cancer, brain cancer. What's a tumor? Tumor isn't cancer. Tumor's a tumor, pocket of fluid. What kind of fluid do you reckon is in cysts and tumors and things? Well, take your pick. You got blood and lymph. If you combine them, you have interstitial fluid, which is what most tumors are. All right. Why would that? Why would fluid back up in the body? Because a doorway's closed. There's a dam somewhere. Something blocked. Some obstruction. Could be. You know. Obviously. Now, when you damage a cell, that's what's cancer. Well, what damages a cell? Something fly in from Moose Jaw, Alaska? I mean, this is the kind of idiocy that's out there. People are throwing money and running down the fear road. It's amazing. I imagine some of these guys are sitting back laughing at humans and how stupid they are when it comes to this cancer and how much money they're raking in off of people. And I look at these poor souls, and their hearts are out there. They don't want breast cancer. They've had breast cancer. They're breast cancer survivalists, but they went down the wrong road to survive it. So something's liable to come and hit them later. And, you know, the residual kick, and they just don't know. So there's so much ignorance there. We've got it. And CNN, to me, did the best show on that. It was just a short segment where they went to a chemist and asked a chemist what causes cancer. That chemist explained that in 1 minute. Thank you. So, you know, those people that are out there, get knowledged up, like all you people on YouTube. Our channel's a good channel. You guys are getting knowledged up, and don't be fooled. Any cancer you go to, you're going to always work on the lymph, including leukemias. Leukemias are going to be your easiest cancer, but you're going to hit the liver, clean the spleen, build the bone marrow up. Absolutely. But you're going to also clean that lymph system. I wanted to show you this. I've had this a long time. I don't know if I ever showed you this, but just to give you one show here. These are in the old videos, but look at this. To reduce your risk, and of course the foods you would take for cancer, right? Look at all those raw foods. Look at all those raw foods. Now, who wrote this? American Cancer Society. You won't get this anymore. I've drug this around with me lecture after lecture to show you at one time there was some thought of helping people.